So CBT is one of the most effective treatments when it comes to reducing tinnitus distress, and as an addition, acceptance and commitment therapy, as I perceive it as coach, as the most important thing, is an extension of cognitive behavior therapy and is really helpful for managing the emotional distress and changing the way your brain reacts to tinnitus, so it can relearn that it has nothing to fear from tinnitus and that tinnitus can be there, but it can go into the background and you have nothing to fear from the existence of your tinnitus, which is when you can habituate. And the third part that the guidelines mentioned, if and only if you have hearing loss that needs to be treated, are hearing aids indicated, right? So if you have measurable hearing loss, hearing aids, this is what the wording says, hearing aids can help by reducing the contrast between tinnitus and silence.